afternoon. Welcome to our three-part presentation, Riding the Waves of COVID-19, an information series for families of children and youth with special healthcare needs and disabilities, presented by Family Voices of Wisconsin and UW Pediatric Pulmonary Center. A few instructions for this webinar. We will be recording this webinar for future viewing. Your microphones and cameras have been muted and turned off. Please keep your video and microphone turned off during the presentation. We will be taking questions that we will try to answer at the end of each presentation. You may enter your questions in the chat box throughout the presentation. We will not be able to answer any questions about the medical conditions of your children, and if you have questions, we would have you discuss them with your primary care physician or healthcare provider. We may not have time to address all questions entered into the chat box during today's presentation. We will be reviewing all questions submitted through the chat box and will send out a summary of the questions and answers. We will be posting the responses on the Family Voices website and the UW PPC website. A survey link will be shared in the chat box at the end of the presentation. We appreciate your feedback. Please fill it out to provide input on future topics. I would now like to introduce our speaker for today, Dr. Vivek Balasubramaniam.
Good afternoon and welcome to this webinar brought to you by Family Voices and the University of Wisconsin Pediatric Pulmonary Center. I'm Vivek Balasubramaniam and it's a pleasure to be the first presenter for this webinar series. I'm a pediatric pulmonologist and co-director of the Pediatric Pulmonary Center. And in my clinical practice, I take care of children and youth with lung diseases. I'll be speaking to you today about a look back and where are we now in terms of COVID. This will be followed tomorrow at 12:30 by Dr. Mary Ellenbach, who will be speaking on a look forward and how to emerge from staying at home. And then finally, on Thursday at 12:30, Dr. Stephanie Farrell will speak on the strategies and tools for maintaining and boosting resilience. Now, I know over the past 9 weeks, we have all been forced to try to become experts in virology, infectious disease, epidemiology, and public health. I don't know about you, but sometimes I feel a bit overwhelmed by the amount of information that is coming out daily and how to digest and interpret it all. More importantly, I've really been concerned about the impact that this novel virus had on my patients with complex chronic medical conditions, including children with physical, developmental, behavioral, or emotional differences. In light of that, I thought I would start by reviewing what we know and what we've done to contain this disease process. So this coronavirus, also known as COVID-19, that is causing this disease is different from the other coronaviruses that have commonly circulated amongst humans for years. Those other coronaviruses usually cause a mild illness, but this strain or form of this virus appears to cause more severe disease. This form of this coronavirus starts with symptoms of fever, cough, shortness of breath or difficulty breathing. Patients can have fatigue, sore throat, headaches, and a loss of smell or taste. In addition, some people have been presenting with nausea and vomiting and diarrhea. As you are all aware of, these symptoms can progress to either a more severe illness or can resolve over the course of 10 to 14 days. There are even reported cases of mild to no symptoms in people that have tested positive for the virus. At this point in time, there is no treatment for this virus. In severe cases, there are tests being undergone for medications that will help with patients who have severe illness. But at this point in time, again, I got to reiterate that we don't have a treatment that everyone can go get. The challenge with this COVID-19 is this virus seems to pass along or seems to be transmitted easier to other people than other viruses such as influenza or other viruses that cause the common cold. And then when this virus is passed on, it's not really clear which people will have mild symptoms or which will go on to have severe disease. As this virus was first only discovered and described back in December, which doesn't seem that very long ago, we are still learning about how this disease presents and what are the symptoms that may indicate whether a person is going to have severe disease or mild disease. Now, because of the increased infectivity or transmission of this virus, in March, the state of Wisconsin was placed under the condition of safer at home. This was in the goal to try to decrease the transmission or passing along of this infection. The reason for this was to decrease the number of cases in our state so that our healthcare system did not get overwhelmed by cases, like we all witnessed on the news in places like China, in Italy, and even in New York City. Again, the goal was to decrease the number of new cases we see each day. So what happened? Did we in Wisconsin succeed? Let's take a look at the numbers. So as of today, the state of Wisconsin has tested almost over 200,000 people for coronavirus 19. There have been 15,584 positive tests, and of those, 15%, or 2,339 people, were needed to be hospitalized. Fortunately, we've also witnessed 514 deaths from COVID-19 in our state alone. The good news is that over the last 14 days, we've averaged about 350 to 400 new cases, and that level of new cases has remained relatively stable. So congratulations. By staying at home, by practicing social distancing, we have started to flatten the curve on the new cases, and it felt we might be ready to emerge from safer at home and restart our interactions in society. So as we start those interactions in society, what are we going to do? What are the safe methods that we use to go, and how are we going to do this? So if we all remember, when we started with safer at home, the things we talked about were social distancing. What was the purpose of social distancing? The purpose of social distancing was that we do know that when we are in enclosed spaces or in close proximity to people who are sick, there's a higher likelihood that we're going to get a disease from them. By increasing the distance from people, we decrease the rate at which we can transmit those diseases to other people. The big challenging thing with this novel coronavirus was often people were walking around that did not know that they were either infected or sick and could transmit it all. So by practicing social distancing, by decreasing the number of people around and in crowds, we were hoping to decrease the rate at which this virus was being passed from person to person. The whole goal of this, again, was to flatten that curve on the number of cases each day that we're presenting so that we wouldn't overwhelm our healthcare system. By doing that, what we've done is we've been able to find out that this actually does work. In addition to this, other strategies that we can utilize, such as wearing a mask, also help decrease our transmission of this virus from one person to another. Now, how does wearing a mask work? Wearing a mask will not necessarily protect you from getting a virus, but what it does is it will protect you from transmitting that virus by either accidentally coughing or sneezing and spreading particles of the virus through the air that may be inhaled by somebody else who's in your close proximity. So if I'm wearing a mask and you're wearing a mask, that means we're protecting each other from getting this disease. And that seems to be working. In places that have been using masks, they've shown that there's a decrease in the number of cases that are being spread. So we should continue to think about this as we move forward. Now, as we're thinking about these novel coronaviruses and what this disease means, what are we going to do about it going forward? And what have we been able to do that's really been successful? The two things I can tell you that we've done is increasing our hygiene, or that's washing your hands, and using masks when you're in contact with other people that you don't know. Now, Dr. Ellenbach is going to spend some time talking about what we need to do going forward and what we should do in terms of thinking about our children and our youth with special healthcare needs and with special complex medical conditions as we take them out into society. So with that, I would like to open it up for questions that we have.
Hello, Vivek. So one of the questions that we have is about the new inflammatory disease that has been in the news. And the question is wondering what they can do, what the most recent information is on that.
Sure, that's a great question. So one of the things I can start by saying is that we all are worried about our children. We all are worried about, will this virus affect our children and what the severity of that infection will be. What I can tell you is that in speaking to other healthcare professionals from around the country in weekly conference calls that we've been having, talking about our children and youth who have severe respiratory diseases, we really have not been seeing severe cases of coronavirus-associated infections. We've been seeing mild cases of infections in the few children that were reported, but most of the children who had underlying conditions such as asthma or other respiratory problems really had not been presenting with severe exacerbations of their underlying disease, which to me as a pediatric pulmonologist has been reassuring that our children are actually really not succumbing to the severity of illness that we've been seeing in adults. Now, one thing that has come about is that as we've been looking back, there have been some reported cases of an inflammatory condition. So what that means is that there is a condition that's triggering the body to get inflamed or activating the immune system in the body that seems to be targeting the blood vessels in people's bodies. And these have been found in children specifically that seems to be similar to a different condition that we've known of as called Kawasaki syndrome. Now, we don't really know what the mechanism or how this coronavirus is triggering this type of an illness. But what we found is that there have been some reported cases of an increase in this type of inflammatory vasculitis or inflammation of the blood vessels in children that have been also tested positive for coronavirus. At this point in time, that we don't have a treatment for it again. Those children have been treated with steroids, which have helped them, and as of now, we really don't have any markers or anything that will be predictive if a child is going to go on to present with this or not. What we have been doing is that we really want to emphasize that if your child is having symptoms, that they should talk with your healthcare provider and discuss those symptoms and whether or not the child needs to be seen to having either blood testing done or other tests done to look for those symptoms.
Thank you, Vivek. I am sharing a survey link, and we would appreciate if you would share any feedback that you have on today's presentation, and also encourage you to submit any more questions that you have so we can